Hi, everyone. My name is Courtney, and I'm here with GeorgAnna, and we are going to talk to you today about ketamine-assisted therapy, just going to view the ins and outs of that, and hopefully answer any questions you have about this technique, which is really gaining a lot of momentum right now for good reason. So, I am Courtney. I am a licensed therapist in Georgia, Indiana, and Oregon, and I'll let GeorgAnna introduce herself as well.
I'm GeorgAnna Wiley. I am a nurse practitioner, midwife, functional medicine provider, herbalist, and my entire career is devoted to helping people heal from trauma and where that intersects mental, spiritual, and physical health care.
Yeah, wonderful. And so both of us are pursuing ketamine-assisted therapy for our clients from different angles. Georgiana definitely from that medical lens and the trauma-informed lens, and myself from the therapeutic trauma-informed lens. And so thinking about what ketamine-assisted therapy is, what we're looking at is using ketamine to enhance people's ability to process, to explore content, to integrate trauma, and doing that all in a way that feels gentle and manageable. With the added component of therapy to guide someone through that integration process after the ketamine experience.
Right. So really addressing the setting, and support piece of healing and really moving past trauma informed into healing centric.
Mhm.
So thinking of how ketamine as a dissociative agent can take away some of the ego and get you below that into what the deeper roots of what your issues really are and to heal more of those deeper layers.
Yeah,
That's the magic of
absolutely.
ketamine. Yeah.
Yeah. I mean, I think it really does, like, it helps people get to some content that maybe their conscious mind would really want to prevent them from getting or doesn't even really know is there to be explored or looked at in a different direction. And so I think you're right, really saying that this model is geared at creating healing and integration and wholeness versus just saying, okay, I'm holding space for trauma, but saying, okay, I'm holding space for trauma, and now I'm also transforming that into this brighter future.
Absolutely. And, just to talk a little bit about what is ketamine. Ketamine is a pharmaceutical that is legal and a controlled substance that is regulated. So it is different from a lot of the other ceremonial plant medicines that are used that can be beautiful in their own way, but are illegal. And ketamine is one of the World Health Organization's top five most essential medications as it's used in emergency rooms and battlefields and on the ground anesthetic agent that has been found to be one of the absolute safest pharmaceuticals for pain management. We are using it at a much different lower dose than what you would use as an anesthetic, that has been found to have significant benefit of a lot of mental health conditions, as well as chronic pain, addiction, suicidal ideation. So we are going about it slightly differently from a lot of clinics that are intentionally doing a very low dose that is not psychedelic. The research supports psychedelic use at higher, but not the highest doses that are used for anesthetic purposes, but a psychedelic dosing to really work on some existential healing and existential crises and a much more profound healing state than you would find in an IV clinic low dose setting.
Yeah, a lot of those settings are really sterile also in their environment. So they're lacking kind of like you said, that set and that setting that really do help that transformative experience. And so it can be, I think, really um, disorienting for people to be like, okay, I'm here. I'm like feeling some sort of maybe very, very light effect from the ketamine, and I'm not really getting much out of it because they've just sat me in front of a nature documentary or with my phone, and I'm just supposed to sit here and hope for the best.
Which, not to knock it, I find that
Yeah.
like people do find some great breakthrough in the IV ketamine approach, but the dose is lower. There's generally not a therapist holding your hand through that session or significant prep work to help prepare for the healing, as well as the integration piece of what do you do with this newfound knowledge and how do I make lasting change. That it's really more of we're giving you a chemical, we're tinkering around with neurochemistry and neuroplasticity and you're out the door, right? So
Mhm.
we really want to bring an immersive experience with sound therapy and a lineup of healers and somatic integration work and art therapy and all these modalities that unto them their own are healing. But if we can take you into a ketamine assisted state and then bring all this deeper healing in with other modalities, we can really make significantly deeper healing possible.
Mhm.
So we are going a very different direction and bringing it in more of a ceremonial way to everyone.
Absolutely. It's kind of that sweet spot where that science really is meeting the ritual and in the intentionality of this work, where we're taking what we know is happening structurally in the brain and we are capitalizing on that neuroplasticity by incorporating all of these really, really intentional, beautiful practices that have their own healing elements as well in order to really heal this whole person. From, the very smallest part all the way to kind of that cosmic integration where they're really at one with the universe in some way.
And thinking of ceremonial aspects, that our culture has very few ceremonial marriage, funerals, baptism, and that's kind of it. And we have all these amazingly profound peak life experiences. And if we can make it more ceremonial so it feels more lasting and beautiful and healing centric for us, I just find that that's such a more and beautiful, empowering experience than just an IV drip clinic.
Yeah, absolutely. And then I know a lot of people ask about like what it feels like to have this ketamine experience. A lot of people who maybe have not had any experience in their lives with any type of psychedelic are just really kind of going on maybe what they've heard people say or things that have happened, in the movies, right? And so like really trying to help people understand that for one, because this is in a controlled environment where it's been prescribed by,
Me.
yeah, by you, that there is a sense of control, right? Like people are in a safe space, they're at a therapeutic dose that is both high enough to really get them to some of that ego dissolution, to that transcendence, but not enough to where, like you said, that they're completely anesthetized and unable to respond. I think most people, even when they're in these experiences and going on this journey, they may have the sense of like separation from their body, that disassociation from the physical form. But we do a lot with our clients to really keep them grounded to reality in the sense of like they know they're going to be coming back to, the real world experience and that what they're sensing in any kind of dreamlike or, more psychedelic bits of that experience are really grounded in that functional work and in the sense of, returning to body, being grounded by also the setting of the music and the scent and all of these other elements that are incorporated into, the ketamine assisted therapy.
I like to think of it as a soul-led vision quest to tap into your inner guides and your inner knowledge, that's really what this is about. That's not the same as recreational drug use. It's not the same as street ketamine use. That, like you said, it's within a very contained, safe environment. You will have an intake visit with Courtney to go through the mental health sphere of how this would be helpful for you. And then you'll also do an intake with me. So I see a lot of depression is due to thyroid issues, hormonal issues at play for mood disorders. So let's come from a functional medicine and Western medicine lens to see if there's anything else that might have been missed that we can address to help you be the best version of yourself. So all of that is incorporated into what we're doing too. Um, and then also offering a variety of formulations and dosing too. So if you're new to psychedelics or you're new to this form of treatment, you might not be comfortable with the idea of an ego dissolution death, an ego dissolving dose. Um, so we can control the dose to go low and just be very calming and soothing and exploring and good for anxiety. Or we can just go full dose and enter in those profound states to really get at what is underneath that you need to address in your journey of life.
Absolutely. And I think that is another one of the key differences between, the IV clinic setting and this type of setting is that each person has a little bit more control over like, okay, what do I want to get out of this? If this isn't working for me, I have flexibility to work with the prescriber and the therapist and to really maximize this experience for myself.
And a big part of that really is the formulation of how you get it in. So a lot of online providers, your only option is troche, which is like a little dissolving what would you call that? Like it's a piece of
Just a
candy.
tablet or
Um
yeah, but something you like
yeah,
everyone does those Zen like those nicotine pouches,
mm,
but I guess they dissolve more
yeah.
than that.
Yeah. So that is not as well absorbed and comes with more nausea, but it's very appropriate for some people, right? So that's an option, and we can control the dose. It's called bioavailability of how much of the dose you absorb. And the oral, anything coming through the mouth, is a lower bioavailability, which means that it's harder to get the desired effect with the dose because everybody can respond to that same dose differently. So we also are offering intramuscular injection, which we can also control the dose for what type of experience you want, but it's easier to control the higher dose ego changing doses. We can also do intranasal, that one's also popular. Um, and we can also do sublingual dissolving tablets, which is another form of oral that you don't have to suck on as much.
Mhm. Yeah, absolutely. And even
And then
when
we also
people, Hmm?
Go ahead. I was
Oh,
going to say we also have an arsenal of nausea
mhm.
medications, and if you decide this journey is not for you and you want out, there's medications, benzodiazepines that we can give to bring you out of that experience if you're uncomfortable. Although thinking about the art of surrendering to something, right, that often change is a little bit hard, and we want to fight against it because we want that security of what's familiar. So we can hold your hand in any sort of issues that may come up. If you have high blood pressure, I can manage your blood pressure, right? So the health side of it is very well taken care of.
Absolutely. And really being there, like you said, for that hand holding and for the process of saying, okay, I am going to surrender to this. And I know that I'm doing it with someone right beside me if I need that, with someone holding my hand, someone stroking my hair if that's what I want, or if I really need no one to touch me, then that's perfectly fine too. Um, and so really saying that there is that flexibility available. And even if people are, choosing those lower dose options, there really is still that opportunity to do that deep work. And we're really blending in things like internal family systems, IFS, shadow work, that trauma-informed care to really help people get the most out of that experience, whether they're doing the really low dose or they're really going as far as they, really desire to have that bigger, ego dissolution experience.
And they get the benefit of having a trauma therapist trained in EMDR and IFS approach at their beck and call for
Yeah.
the whole experience, right? Of like coming into it prepared,
Mhm.
having a safety net during the experience, as well as the integration piece and the community building of
Mhm.
going into a group setting for therapy can be very beautiful of hearing other people's experiences and journeys and interpreting the visions that happen during the course of the ketamine treatment, and fostering those relationships, because that's another thing we lack in our culture is
Mhm.
the community piece. We're often so fragmented and isolated within ourselves and within the community that getting to hold hands with like-minded people can be its own form of therapeutic benefit.
Absolutely. And again, like just really bringing life into a therapy environment, into a medicine environment where we're really taking medicine not only in the sense of that ketamine, however people are ingesting it, but also the medicine of sound, the medicine of community, the medicine of these, larger internal journeys where we're rescuing these younger parts of ourselves. We're integrating that shadow self. We're really, making friends with the whole system.
And even the sound piece, a lot of providers have very curated sound playlists that they use for when people are doing ketamine therapy. And so we've really gone a step further than that into having it be sound immersive healing. So a sound bath around you that is curated to the experience as well.
Mhm.
And with bringing you into the session with guided meditation and integrating somatic therapies and all of this stuff that's very research based with very strong evidence unto themselves and bringing that together in one retreat. We're super excited to launch this.
Yeah, absolutely. And then just so that we can let people know about contraindications, as you said before, ketamine is super duper safe. It is one of the most essential medications according to the World Health Organization. But of course, there are people for whom ketamine treatment really isn't maybe the best option. Do you want to just kind of like go over some of those medical contraindications?
So the main issue is blood pressure can rise a little bit during ketamine. So people that would not be able to tolerate vigorous exercise due to cardiac issues. So that is your significant coronary artery disease, hyperthyroidism. Hypothyroidism is different, and that is something that I'm happy to treat for you at the intake visit and get well managed for you. Intracranial pressure elevation, or pregnancy.
Yeah, good. And then looking from the psychological standpoint, ketamine typically is not the best choice for people with diagnoses of psychotic disorders such as schizophrenia and people that have had recent manic episodes or bipolar where their treatment isn't really stable. However, with some stability, there is definitely room to incorporate the ketamine treatment. So if there are any questions about that, like we could talk about that during that intake and make sure that ketamine was the right fit for everyone, both from that medical and therapeutic standpoint as well.
Absolutely. Yeah. Um, and thinking of what it's specifically good for, so the mental health spheres, which you can elaborate on, but then also chronic pain syndromes, very effective for that. For end of life care, for addiction disorders, for suicidal ideation, it can be helpful for those as well. And then if you want to highlight some other mental health
Mhm.
things.
Sure, absolutely. I mean, there's a ton of research really showing how powerful ketamine is in treating depression, especially, any kind of treatment-resistant depression. Also really great for anxiety, PTSD, just even adjustment grief disorders. There really is a lot of benefit coming from that increased neuroplasticity for just about any kind of mental disorder that people might really come to the experience with, but particularly depression, anxiety disorders, and trauma.
And thinking of how ketamine is unique in the mental health sphere by you can do ketamine while you are on psych meds, so
Mhm.
like depression medications, anxiety medications. It's not a contraindication like it would be for a lot of other plant-based modalities. And we are happy to help with medication management along the way as well, or I'm happy to help with it.
Yeah, absolutely. Well, I hope that this answered a lot of questions for people, and feel free to check out our retreat webpage at innerhorizonretreats.com. You can also from there reach out to either one of us if you have questions about ketamine therapy, either from the medical standpoint, Georgiana would probably be your best contact, or for the psychological, you can reach out to me or just hit either one of us up and we can always direct you where you need to go because we'd be happy to answer any questions that you have about ketamine assisted therapy and how that might be a benefit for you.